Welcome back, coders, to part 32 of our 100-part CPT exam series. I'm your host, Harshal. To really conquer the CPT surgery section, you've absolutely got to master those tricky in-between systems. Today, we're decoding the procedural codes for the Hemic, Lymphatic, Mediastinum, and Diaphragm systems. But before we unlock these exam secrets, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Your support is exactly what allows us to keep this massive 100-part masterclass totally free for you. All right, here is our roadmap for today's explainer. Number 1, overview. Number 2, spleen and bone marrow. Number 3, the lymph system. Number 4, mediastinum and diaphragm. And 5, a high-yield cheat sheet. Let's jump right into Section 1, overview of CPT code range 38100 to 39599. So this specific block is basically your guide for the blood and immune systems, plus the central chest cavity. Whenever you see procedures involving the spleen, the bone marrow, lymph nodes and channels, the mediastinum, or the diaphragm, this is exactly where you navigate to in your CPT manual. Moving on to Section 2, spleen and bone marrow procedures. What's really fascinating here is how CPT separates splenectomy codes based on the surgical approach. This is a massive exam trap. For an open splenectomy, you use base code 38100. But if the surgeon uses a laparoscope, jump over to 38120. And if the spleen is removed en bloc, meaning it's taken out entirely attached to surrounding organs, you'll look at 38102. Approach literally changes everything here. Let's pause for a second. I've got a quick mid-explainer test for you. Think back to our global surgical rules. Is a splenectomy billed separately if it's performed during a major abdominal procedure, like a total gastrectomy? No way, it is absolutely bundled. Under the NCCI guidelines, if a splenectomy is just incidental to a larger surgery, it gets completely swallowed up by the primary code. You only report it separately if there's clear documentation it was done for a distinct reason, like an unrelated trauma or for cancer staging. And that brings us to bone marrow procedures. The CPC exam loves testing if you know the difference between drawing fluid and taking solid tissue. Code 38220 is purely for liquid aspiration. On the flip side, 38221 is for a solid tissue biopsy. If a scenario just vaguely says marrow was sampled, you've kind of got to become a detective. You must read that operative note carefully. All right, Section 3, lymph system and mapping rules. For limited lymph node sampling, your code selection hinges on intent and depth. Are they doing an excision or just a biopsy? And is the approach superficial, just right under the skin, or deep into the muscle? The documentation must explicitly state this depth, otherwise you risk grabbing the wrong code. Let's build on that concept. A sentinel lymph node biopsy, or SLNB, is targeted sampling of just a few draining nodes. Now contrast that with a radical lymphadenectomy, which is a massive regional dissection for complete clearance. The golden rule here? Never confuse a limited sentinel biopsy with a radical regional clearance. And for those sentinel biopsies, watch out for add-on code 38792 for lymphatic mapping. Remember, because it's an add-on, it can never stand alone. It must always be reported alongside your primary surgical excision code. Almost at the finish line. Section 4, mediastinum and diaphragm coding. For the mediastinum, that vital space between the lungs, mediastinoscopy codes 39401 and 39402 split primarily on intent. Was it purely diagnostic, or did it definitively involve a biopsy or excision? Also, if the surgeon is removing mediastinal tumors, watch the approach. A transthoracic entry versus a sternal split will dictate exactly which code you pull. Down at the diaphragm, hernia repair codes hinge entirely on the origin of the defect. Is it a congenital hernia, a traumatic hiatal hernia, or an eventration, which is a dangerous thinning in the muscle? The origin dictates the surgical code family, so you've got to read the diagnosis carefully. Let's wrap it up with Section 5, high-yield cheat sheet. Mental snapshot time. Spleen, 38100 is open, 38120 is lap. Marrow, 3820 is aspiration, 3821 is biopsy. Lymph, SLNB is limited, radical is complete clearance. Always pair your mapping add-on 38792 with the primary excision. And for the mediastinum, separate your diagnostic scopes from your surgical ones. Excellent work today, coders. Up next is part 33, where we're tackling the massive digestive system. We're talking GI endoscopies, colonoscopies, and those complex hernia repairs. Until then, brush up on your bundling rules. And I'll leave you with this final thought. When you read an operative note, are you just coding a procedure, or are you actually capturing the true scope and approach? Keep decoding, and I'll catch you in the next explainer.